does this tell us? This tells us that perhaps Mary Bowen's view of problems, significant problems, of patterns of problems, do trickle down from one generation to another. Eric having a mental illness of some sort, Dana having a substance abuse problem, also being a victim, Jim having a substance abuse problem and being involved in the criminal justice system. And if you take a look at the marriages in the third generation, we could also see some dysfunctionality going on there, especially here where two people with legal problems are involved with each other and ended up getting divorced. And here we could actually see the fourth generation experiencing the similar sort of problems that the third generation experienced, in the example of Beth already at the age of 17 being involved with the law and having some drug problems. The genogram is a very useful tool, and it's very easily completed. Usually the whole family is brought around a table, and it's done right there and then during a family therapy session. A piece of paper is taken on which all of this is drawn out within 15 minutes or so. Family members are taught how to interpret the diagram and are also asked to provide their own input. After all, this is their family that you're drawing. And family members tend to get very involved with this process. They like it, it engages them, and at the end it serves the purpose of having them think deeply and gain more insight, hopefully, about the types of interactions that they're having. Again, the diagram could get as complicated as you want it to be without overcomplicating it. After all, the point of the diagram is to clearly observe the types of interactions that occur. In other words, it could also portray the quality of the emotional relationships that take place between family members, and so on and so forth. And speaking of the diagram like this, and also keeping in mind Mary Bowen's view of family as being a system, as being an extended system, we could also focus on the present family, in other words, on the nuclear family in the present time, without taking a look at other generations involved. And going back to the theories of Alfred Adler, who spoke about the importance of sibling position in the family, and also keeping in mind the concept of the identified patient and the concept of enabling, usually being done by the spouse of the identified patient. We could examine the types of roles that certain family members, usually all of the family members, play within the family system. For example, if we take a father who has a substance abuse problem, and we take a mother who knows of the problem, yet does not do anything proactive to stop it, rather takes on the extra duties and responsibilities that the father is now neglecting and performs them herself in order to keep the family going. In our view of this mother, this would be a hard-working mother who's trying to save the family. However, in light of the father's substance abuse problem, in light of her not doing anything active to stop it, she's in fact enabling him, allowing him to go on having the problem without having to make any changes. Now, if we take a look at what role the kids play, they also play several different roles. Usually the oldest child is conceptualized as what we know as a hero. A hero is a child who sort of makes up for the family's problems by being exceptionally successful, exceptionally smart, well presented, and so on and so forth. This is usually the oldest child who goes to college, who succeeds in college, who gets a good paying job, and this is the sort of a child that at family gatherings the family sort of brings forth and presents as the symbol of the family. Because if you think about it, who else could they present as the symbol of the family? Not the father with the substance abuse problem. Rather, they present this successful son that they're proud of. In other words, the hero takes on the role of being the face of the family, again, in order to minimize to the outside world, as well as internally, the sort of problems and the extent of problems that exist within the family. The second child is usually termed the family scapegoat. The term scapegoat implies that whatever problems occur, whatever issues occur, are not being dealt with directly by the people who are experiencing these issues between themselves. These issues are rather dumped on the scapegoat. The scapegoat takes the brunt of all the problems, takes the brunt of all the issues that occur in the family's daily life, anything from minor things like who didn't take out the garbage to major things such as the father's drinking and the results of that drinking, perhaps. The scapegoat does not respond favorably to these kinds of accusations and these kinds of blame-placing games, and usually ends up engaging in some sort of dysfunctional activity himself or herself as well, which is only natural in response to how the family members treat him. The scapegoat is needed in the family system. Again, it's not a good type of a role to play, but it is needed in order to maintain a homeostasis or the balance within the family. Otherwise, the tension that is created by the numerous problems builds up, and it has to be released in some sort of a way. The scapegoat is that release valve. The third child is usually what's called a lost child. The lost child is a child that withdraws from the family, usually finds solace in solitary activities, playing by himself, reading by himself, and so on and so forth. The lost child is not very involved in the family's life. He or she realizes the types of problems that occur within this family. It does not want to have anything to do with it. However, he or she cannot really run away until they grow up, but they choose escaping or limiting their contact with the family as a way of minimizing their having to deal with these problems and experiencing the effects of these problems. The lost child tends to be a follower, tends to be isolated and quickly overwhelmed by his or her siblings. Last but not least, the youngest child in the family is described as a mascot or sort of a clown. Likes to deal with the family's tension, or chooses his way of dealing with the family's tension by being overly playful, by drawing attention to him or herself, and by performing tricks, little pranks, and so on and so forth, in order to dissipate the tension in the family. The mascot is usually loved and is usually well accepted by all family members. Again, this is the youngest child way of dealing with the problems in the family. So as we could see, each family member plays a certain role. Each family member takes on either a functional or dysfunctional way of dealing with the problems that exist within a family. The role of the counselor or the therapist in this case in bringing the family together in treatment is having the family members identify their own individual roles in the system's problems and identify certain things that they're doing continually and repeatedly that perpetuate the existence of these problems within the family. The therapist then takes the family members through a process of gaining insight and also improving communication patterns, as well as general types of interactions and activities that occur within a family. The therapist also takes the family through examining their feelings such as guilt, shame, resentment, and so on and so forth, to have the family members successfully deal with those feelings and discuss them out in the open, as opposed to harboring them inside and having them spill out through other dysfunctional behaviors.